She has over 130 publications, including 7 or 8 books, and not just edited volumes, by the way, and has been writing and working in bioethics for many, many years. It's not just quantity, but quality work. And she blogs. I just had to tell you that. So she serves as an advisor to the World Health Organization. She's chaired the UN AIDS Ethical Review Committee for a number of years. She's an elected member of the Institute of Medicine, a Hastings Center Fellow, has been president of the International Association of Bioethics, and won a Lifetime Achievement Award from the American Society of Bioethics and Humanities. And I could go on, but I won't. There's not enough time. She began working in global health in 1988 and really hasn't stopped since. She co-directs, I think, one of the first, if not the first, international training programs from the Fogarty Center in research ethics in Buenos Aires, and a training program conducted completely in Spanish. And she has, as I said, written a number of books. Her most recent one, by the way, not on my Kindle this time, but in real life, is a collection of previously published articles on global health, and I highly recommend it. I especially enjoyed the chapter on vulnerability, the theory of vulnerability, which is an important issue and has always been an important topic in research ethics, but she brings it really with great insight into the domain of public health and health equity as well. So, speaking of which, her talk today, Global Gender Justice, Violence Against Women, Whose Responsibility? And I greatly look forward to educating this.
I don't know why people always applaud before the talk. You haven't heard what I'm going to say yet. Thank you for inviting me, and thank you for that kind introduction, Susan. I was going to warn the audience about some of the pictures, but after seeing Dr. Jacobson's video, I think you've seen the worst. So I'll give the kind of warning they do on TV, which says some of the images you see may be distressing, so it's just fair warning. But I'm going to need your help because I don't know the answers to the question. The subtitle here is Whose Responsibility? And that's really the question of gender justice. After showing the pictures and some of the statistics on the problems largely stemming from cultural factors rather than medical neglect or lack of ability to, for example, in reproductive health, the question then is who has the authority, who has the will, who has the political will to do something about these problems, because they're not happening within the cultures and within the countries. So here are some examples, and as I mentioned, I'm going to focus largely on the cultural underpinnings of the violence against women. In every country, in every culture, there's domestic violence, intimate partner violence. This is true everywhere. But only in some places are there the kinds of cultural factors that give rise to these kinds of problems. So dishonoring the family. There are, as probably many of you here know, cultures that are referred to as honor cultures, in which a variety of things that are conducted by a family member may dishonor or shame the family. For the most part, it's things that are done by women, and usually, of course, in the area of sexuality. This is a response to, I believe this was the rape that got that got such publicity in the newspapers that occurred in Delhi, where people were holding up plaques that said 93,000 rapes, apparently things that the government doesn't do anything about. Here's a picture of women. As you can see, in this state, Uttar Pradesh in India, they have to have train cars that are solely for women, because it's simply unsafe for women to get onto a train that would have men in the cars of a train. There are also such cars in Cairo in the subway. So the women themselves, of course, are fighting and struggling to get onto this train, because if they don't get onto this car, then they have to get on the car with the men. So most of the, as probably again many of you know, there's been a great deal of attention to health disparities, sometimes referred to as health equity, but health disparities. And this has focused mostly on gaps between industrialized and low resource countries, poor versus rich, middle income versus low income, both gaps within countries showing that health disparities, the people in the middle and upper classes have better health overall, better longevity, better health than people in the middle and lower classes. So this is true, for example, for measures of life expectancy, for statistics that have to do with the burden of disease, but very little attention has been paid to health disparities between men and women. Most of the study, most of the focus has been on economic disparities and not on gender disparities. The World Health Organization that has addressed this topic, I don't know how many studies there are altogether, but the World Health Organization says gender disparities in health are often striking. And if you go to the WHO websites, they have issues, departments that deal with women's health, and you'll see some of the reasons, some of the breakdown of statistics and some of the reasons why there are gender disparities in health. Not surprisingly, a lot of those disparities do have to do with reproductive health, particularly the areas in which there's unsafe abortion, because all of the laws against abortion, which exist in most, but not all, but most of the developing countries, have not by any means stopped the incidence of abortion. Abortion will continue no matter what the law says. It's just that they become, abortion is less safe. So this is a new United Nations organization. There used to be, I guess it was, we saw the committee that used to exist on the previous speaker, but now there is an entity, it's called, this is a very, a mouthful here, the United Nations Entity for Gender Equality and the Empowerment of Women. That's the name of the new unit, but people just call it UN Women. And they have these statistics on their website, which you can look at. In some countries, up to 7 to 10 women will be beaten, raped, abused, or mutilated in their lifetime. I mean, that's an incredible statistic when you realize that's 70% of women. And in the studies, WHO did a big study some years ago, and I think there were 15 countries in the study that looked at the incidence and prevalence of violence against women. Actually, I'm happy to report, you probably know these statistics, Dr. Yoshihama, but Japan was the lowest. The lowest. Okay, all right, so you know about it. Japan was the lowest, Peru was the highest. So there's a great deal of domestic violence in different countries, but at least you can be proud. The United States was not one of those countries in the study, but of course we know that domestic violence exists in this country like everywhere. You have women-only trains. That's very interesting, very interesting. All right, so what are the public health challenges then? Some challenges for reducing health disparities, again, gender disparities between women and men, can be met through the health system. And yet primary prevention, as it's known in the field of public health, often lies outside the health system. And it depends here on just what the prevention is and what the procedures are. So it requires more than money or improved health infrastructure. Very often when we look at health disparities in general, and it might be also for health disparities with women, if we throw more money at a problem or build the infrastructure better, that might do some good. But the set of circumstances that I'm talking about this morning are ones money might be able to help a little, but it's not an infrastructure problem, it's very largely a cultural problem. It may require legal action, but here again, in the countries or the areas of countries that we're looking at, there has been very little appropriate legal response. And it may require social or cultural reforms, and that's the area that probably is the most difficult to manage. So it's the latter situation, the requirement for social and cultural reforms, that is the problem with the challenges to women's health stemming from culturally sanctioned violence. And I'm about to give some examples of just what it means to say this is culturally sanctioned violence. So here is the question of justice. I'm putting all these things together here as a kind of introduction when I'm going to ask for your help in what can be possible remedies for this. This is a quotation from one of the leading philosophical contributors in bioethics to theories of justice, Norman Daniels. And his claim is that inequalities are unjust when caused by socially controllable factors. Okay, now the implication is that if there are injustices, that if there are inequalities that are caused by something other than socially controllable factors, biological, genetic factors, for example, which may actually be controllable in the future, but not socially controllable. So his view is that to remedy inequalities, one then has to look at what are the social factors that might be controlled to begin to reduce those inequalities. So the major challenges here are to determine, in the topic that we're addressing here, whether the factors are socially controllable. That is, what does it mean to say that something is socially controllable? Just because something exists as a social factor doesn't mean it is automatically or easily amenable to reforms or changes. And then to determine who has the responsibility. If we actually determine that factors are socially controllable, who then has the responsibility? And I'll come in a couple of moments to questions of global justice and global governance. So the question of responsibility for prevention and control. So here are some of the causes that are unrelated to healthcare services. I mean, usually when we talk about public health, and especially with an audience comprising people from medicine, we think that if we can just improve the infrastructure, the healthcare system, the training of health professionals, and the education of the population in health-related matters, health literacy as it's called, then we can solve these problems. Well, that's not true for these. One example is sexual violence against women. This is not, it's certainly a medical problem when women who have been violated sexually go to hospitals or physicians, but the causes are not ones that can be addressed medically. Rape as a weapon of war and conflict. We haven't heard as much about this in the last 5 years as we did a few years before, but especially in the Congo, armed groups raped tens of thousands of women. I mean, the numbers are staggering when you think about it. Tens of thousands of women. Almost every woman who was living in the aid camps in Darfur, Sudan, was raped or became a victim of gender-based violence. Many of the men were killed. The women lived in the camps, and then they had to, and of course the camps were patrolled, but then they had to go out and gather firewood or whatever they needed, water and firewood. And as soon as they'd leave the camps, these armed groups, militia and others, would come down on the women. Civilian rape, it's an odd term. Why is it called civilian rape? Well, because it's not one of these armed groups. The armed groups are known for raping, so we have to invent a term called civilian rape to contrast it from the armed groups, the militias and others that rape women. Now, this statistic, again, it was a study conducted by people in South Africa. 1 in 4 men in South Africa admitted to rape, and many confessed to attacking more than one woman. Now, when I first read this, I thought, this might be such a macho culture that it leads men to have to claim that they've raped when they haven't actually raped. Well, I don't know which is worse, a culture in which men boast that they've raped if they haven't, or whether they've actually conducted it. So this was, was clearly a study. Now, these are self-reports, and every social scientist everywhere knows that self-reports are not reliable. But if this is not reliable, if they didn't actually do it and they said they were doing it, I mean, what is a culture that gives rise to that kind of response? This is the camp in Sudan, and that's one of the women there sitting behind the barbed wire in the camp. The photos from BBC News, and I apologize, I mean, I know you're supposed to label every photo, and I didn't label every photo, so this one comes from BBC News. Now, here are some more causes, again, unrelated to healthcare services. This was the study that Dr. Yoshihama participated in part of it, reporting between 20% and 64% of women experience violence by men. And some of these women, these were in-depth interviews. There were surveys and in-depth interviews and probably also focus group discussions, because that's the way this kind of research is done these days. Some of these women admitted to the interviewers that before they were interviewed, they thought being beaten by their husband was natural. Now, natural meaning normal. This is just the way it is. You're a woman, you're married, and your husband beats you, and that's life. So obviously, some kind of education, particularly if they're rural people, if they're indigenous groups, if they're people with less contact with the outside world, whatever that might mean, clearly it's a problem both of education and perception, social perception. So the fact that women who are in a study, this is good news about research, that if you happen to be in a study, you can find out that it's actually not natural or not normal or not right, to use an ethical term, to be beaten by your husband. And of course, we know that abused women, even in industrialized countries, but much more so in low-resource countries, abused women remain with their husbands because they have no other source of income. They may have no skills, they may not be able to get jobs, they may actually lose their children if they leave the husband, again, because of the cultural factors. So in most developing countries, the police and other authorities do not intervene. There are no shelters for battered women and no orders of protection. Now, of course, we know that orders of protection don't always work either. But if those possible avenues are not even available, then it means that there is no choice. So women do, in fact, remain with their husbands. And especially if they would be, if they have no source of income, and the only source of income then would be sex work. And of course, losing their children might be an additional reason. There's a quote from a woman who said, "If you are a woman in distress, the last thing you want to do is go to the police," right? This was a human rights lawyer in New Delhi, quoted in the New York Times. Unfortunately, the New York Times is the source of much of what I have to say here, because unlike Dr. Yoshihama, I don't do empirical research. I have to rely on empirical research by others. But my colleagues in India, actually, there is a lot of social science research that I'm going to be using for my future work on what goes on in India. Many women say the presence of the police makes them feel less safe, not more. In case after case, the police have used their powers to deliver women into the hands of their abusers. And of course, if their abusers are their own husbands or someone else within their own family, that's the police just sends them home because there aren't shelters or there isn't a legal means. So the solution in India and countries where rape dishonors women and their family. Now, this is a little bit less so in India than it is in some of the other countries that I'll be talking about. But the idea that when the woman is raped, she is engaging in sexual, even though it's of course involuntary and of course it's coerced, she's engaged in sex outside of marriage. And in an honor culture where sex outside of marriage is something that dishonors the whole family, not just the woman, but her whole family, she's doubly victimized. She is both a victim of the rape, and she may be a victim of all kinds of social opprobrium, including that of her own family. So we'll talk a little more about honor cultures. And in some of these countries, women are forced to marry the rapist, which is the only way to save the honor of the family. So the woman is raped, dishonors the family, and then the solution to this, to make everything right again, is for the woman to marry the rapist. So culture and custom and culture as a source of harm. Here are a few different kinds of examples. And again, these are well known from the, remember, I'm going to ask for your solution. What can be done about all this, if anything, right? Because that's why we're showing these horrors here. The dowry system and bride burning in India. Well, everybody knows about the dowry system. It's the family, often a poor family, that has to pay money to the family of the husband, or the prospective husband, in arranged marriages. Arranged marriages remain the norm, possibly less so in the people who work for Hewlett-Packard and all those people who are in Bangalore and Hyderabad and the call centers, because now they're becoming urbanized. But certainly among rural and traditional populations, arranged marriages are common. And even there was a young physician whom I was in a course that I teach in a postgraduate program in research ethics. That's part of a postgraduate program in clinical research methodology. And he is I don't know if he's American-born or Indian-born. He was a resident and had to go back to India for the arranged marriage, because that was the culture that he came from, and his family was in India. So even though he was completely Americanized, spoke without an Indian accent. He spoke American English, maybe Bronx American English at this point. But when he spoke to his parents on the phone, he would adopt the Indian accented English. And he went back for the arranged marriage. So strong are the cultural ties and the cultural requirements that even people who are obviously highly educated, living in the United States, which is where he will remain, went back to India for the arranged marriage. So back in 1961, which is more than 50 years ago, a law was passed in India called the Dowry Prohibition Act, which makes dowry a punishable offense. Now, I haven't read the act, so I don't know the features of it. It could possibly be that a voluntary arrangement, one in which the bride's family offers to pay dowry, is still acceptable, but certainly anything like a coercive arrangement, which is what this has become now, is prohibited by this act. Obviously, the law is not being enforced because things have gotten much worse. Traditionally, dowry was a way to get the family started. Basically, like wedding presents, some pots and pans, right? Some things to get people, young people off their, launched in their family life. But once the consumerism took hold in India, it became more and more a demand for consumer goods. Years ago, when I first started reading about this was TVs and VCRs. I don't know if they exist anymore, but those things that used to, VCRs and other things. But now it has escalated to the point, they want, it's not only iPads that they want, they want iMacs. So the demands by the groom's family to the bride, and remember, these are arranged marriages, right? So the family gets together to decide on the arrangement. The practice continues despite this law, and not only may the bride's family provide too little by way of money or other goods, that is consumer goods, but even once the original arrangement has been made, and the marriage takes place, there may be additional demands by the groom's family. So if the demands are not met, the husband or the husband's family may burn the brides. And what do they claim? Of course, they come and they're actually committing a crime. They find some way to burn the bride, the young woman, and they claim the stove exploded. Okay. There are other examples of hanging, and they claim that the woman committed suicide. Well, not only is the demand for dowry illegal, according to the Dowry Prohibition Act, but these are now crimes. I mean, these are murders. So why aren't they followed up? The main claim is it's very difficult to gain evidence. Who's going to make the claim? When is the claim made? How does one get the evidence that it wasn't the stove that exploded, or that it wasn't the case that the woman committed suicide? So because of the few opportunities to obtain evidence, and the further fact that even if some evidence is forthcoming, the judicial system in India the wheels grind very, very slowly, and there are very, very few prosecutions. So it's both corrupt officials and loopholes in the law that have mostly favored the offenders, even when there's an attempt to bring them to justice because they do know that the family, or there's some evidence that the family or the husband actually committed the crime, they're not brought to justice. And corrupt officials is a big part of this because it's a separate question from of course we have corruption in this country too, but not to the extent and not to the degree that it exists in other places. So here are some images of brides who have been burnt. The one on the right is, of course, the before and after picture. And sometimes they're killed, and sometimes they remain alive. If they survive, then at that point, even if whether there's any further dowry forthcoming or not, the husband or the husband's family doesn't want this woman anymore. And so she's out of the marriage, and the family, the husband and the husband's family, then get an opportunity to get more dowry from somebody else. So, other examples. Honor killings. Women are killed by male family members for reasons that include refusing to enter into an arranged marriage, being the victim of a sexual assault, where I mentioned earlier the entire family is shamed when women are raped, seeking a divorce even from an abusive husband. Now, here's a quick example in one of the accounts that I read. This was in a journal article. The woman was 28 years old, so she was not a very young bride. Her mother was a physician, and her father was a governmental official, a low community or sort of low-level official in the government. She was seeking a divorce. She had the wherewithal and apparently the money independently to go and seek a lawyer in order to manage the divorce. She went to the lawyer's office, and her mother, I don't know from the account in the journal whether she lived with her parents, but she was already married, so she was presumably living with her husband and now seeking this divorce. In the lawyer's office, her mother, the physician, entered with a man, unrelated man, who pulled out a gun and shot the woman in the lawyer's office. The mother and the person who fired the gun and killed the woman were never prosecuted. They got off completely. They did this in a lawyer's office where the lawyer was a witness. So here's an example. I mean, the fact that the mother was a physician I mention only because obviously an educated person in a healing profession, but it shows the strength of these cultural factors, these norms in the culture, that an educated woman would kill her own daughter because the family is being shamed on grounds that the woman is seeking a divorce. Engaging in premarital sex, which would not count as adultery according to some laws. Susan and I had a little discussion about that last night at dinner. Premarital sex, even if it's with a married person, may not count as adultery on the part of the unmarried person, but would be adultery for the married person. So an unmarried man with a married woman or an unmarried woman with a married man would count as adultery for the person who is the married person, and not necessarily for the other. That depends on what the custom or the law says. So the UN Commission on Human Rights, another source of a lot of information that one can get on these matters, reports that honor killings have occurred in the following countries: Bangladesh, Great Britain, Brazil, Ecuador, Egypt, India, Israel, Italy, Jordan, Pakistan, Morocco, Sweden, Turkey, and Uganda. Well, one might wonder why in Sweden And of course, the answer here, I mean, it sounds like it's an anti-immigrant claim. It's just not, I'm not an anti-immigrant person, but it is now with all of the immigration that has now come to the Scandinavian countries that used to be viewed as the pillar of justice and right. There are now stories actually of anti-immigrant feeling and racism, where they used to accuse the United States of being a racist country. Now that there are African and immigrants largely from Middle Eastern and African countries, the Scandinavian countries are seeing some of what used to exist or be criticized here in the United States. So here is a women's demonstration against honor killing in Iraq, a country that has become dear to our hearts, thanks to George W. Bush. But there are demonstrations, so I'm going to come back to what some of the possible remedies are when we see that this is a collection. As we see in this group, this was a women's demonstration, and where this used to be much less common in the past, apparently it's happening a little more frequently. Well, back to India here. Again, another newspaper account. A rise in the past several years of honor killings of young people who seek to marry outside their caste. Now, outside their caste? Yes, there's still a caste system in India. And the interesting thing about the caste system in India is that they have passed some laws that require that a number of seats, a certain percentage of the seats in parliament, must be for people from the lower castes. I mean, the caste system is not going away despite attempts to eradicate it, make it illegal, etc. But here we have a dual system whereby officials, you know, whenever you read about India in the newspaper, I challenge you, India, every time you see India discussed in the newspaper, it says the world's largest democracy. And this is, in fact, I mean, factually true. There are more people in India than in any other country besides China, and China is not a democracy. So India is the world's largest democracy, but look at these practices that exist. So the caste system is alive and well, despite governmental attempts at reform and the types of reform which are basically ensuring that there is representation in the parliament on the part of people from the so-called lower castes and the one that apparently is still, the word still in use, untouchables, even though that's not the word, it's the Dalit group, which was the lowest or formerly untouchable groups. So one of these honor killings occurred here in the caste intermarriage. And there was an interview by the newspaper of the uncle of the slain couple. They were both killed. This was not just women. Both of them killed. So there's a little bit of gender justice for you. The uncle justified the killing, saying, what is wrong in it? Murder is wrong, but this is socially the best thing that has been done. So this brings us to think about a hierarchy of values. I mean, what is it that might be worse than the taking of life, or the taking of life, at least for this reason? People are getting married outside the social group, or in this case, the caste. Well, what's worse than that is marrying outside the caste. So we're looking at, and also the same, I would make the same point about the honor culture. We're talking about a hierarchy of values in some of these cultures that is distinctly different from the way we think about our own values. And by the way, I had sought to make this an interactive presentation, and I haven't done it yet, but I'm going to be asking for some comments in a minute. But if anyone has any comments or questions, please do them now. We'll have questions at the end, but there's going to be enough time. So if at any point, I should have said this earlier, anyone either has a question or a comment, other than the head shaking that I see, we can address it at any time. In 1 week in India in June 2010, again, a newspaper clipping for the New York Times, 5 sets of couples were killed in 1 week in India. So this is an escalation of something that didn't really exist before. I mean, there may have been a prohibition, but what is it? Are these copycat crimes? Is this something that takes hold, given the strength of the caste system and people's beliefs, so that if there's one and it gets some publicity, then there are others? I'm going to give another example of that a little bit later in another context. So families, which are usually thought of in the world as the closest social unit of any type of social unit, families, and this is now not a marital couple, but the blood-related family, feel they have to act against their own children, most often daughters, to save the family's reputation. So again, it's another example of honor or a destruction of honor. And an Indian cabinet-level meeting was convened to discuss harsher punishment than now exists. Well, this is the response, right? When you don't know what to do, you convene another committee. My question is whether or not this is likely to bring any kind of results. So here's a candlelight vigil in New Delhi for honor killing of a 22-year-old Hindu woman. This was, again, July in 2010. And I'm stressing the publicity of this just to highlight that there are demonstrations, there are candlelight vigils, there is something in the consciousness of the population that is leading to something that we hope can bring about some reforms in the future. Well, it's always dangerous to talk about religion, but sorry, it's part of this this presentation. This is now the Muslim religion. And custom, and I say allegedly according to Sharia law, because I haven't read the law. I've been trying to learn a little bit of Arabic recently because I think it's a good thing for us to, my granddaughter knows Arabic. She's in the U.S. Foreign Service, and she's posted now in West Africa, but she'll be in Jordan. So I think I have to keep up with my own granddaughter and learn a little bit of Arabic. In any case, this is the Sharia law, which it's pretty clear from some examples that are given that people who are the religious figures don't actually know what the Sharia law says. And the single best example, I don't know about the specifics of the stoning, and I think I could probably get an English translation in order to find out, but I think the single best example of spokespersons from Islam who misunderstand or misstate what is in Sharia law is the belief that what is called female genital mutilation, female cutting, female genital mutilation, so-called female circumcision, is part of Sharia law in Islam. It's not. It's not. That is pretty clear. So both members of just ordinary members and clergy persons in the Islamic religion nevertheless continue to say that female genital mutilation is part of the Sharia law, which it's pretty clear from other experts and scholars that it's not. So now we have this practice of stoning adulterers to death. The percentage of adulterers or adulteresses who are stoned is much, much higher among women than among men. So the Pew Center that does all these surveys in 2009 surveyed Pakistanis on their beliefs and attitudes towards stoning to death, okay, as a punishment for adultery. 83% of the people who responded to the survey favored stoning people who commit adultery. But more remarkable than that is this statistic. 91% of Pakistanis who side with people who are seeking to modernize the country favor stoning adulterers. So there are two groups, probably shades of differences, but there are the modernists and there are the very strict traditionalists in many of these societies. And this second group here, that is, they were asked, obviously the Pew survey asked them a series of questions in order to determine, it's again a self-report, but in order to determine whether they are among the group that believes that tradition should remain and all the traditional laws, and those who believe in modernizing the country in a variety of ways. 91% of people in the group that favors modernity still favored stoning adulterers. And what these illustrations are meant to show is the difficulty that exists in trying to change deeply held cultural views, I was going to say moral views, but obviously they're cultural views. So here is the practice, and I read up on some of this. I mean, there are very precise rules for what should take place. This isn't just random stoning. First of all, there has to be an audience. I mean, it's a public event, like public hangings used to be in the United States, or death by firing squad. And they bury the woman up to a certain point in her chest. You can see the one on the left, she's fully buried. The one on the right isn't yet buried. And the size of the stones is prescribed in this practice. They can't be too small because they won't do enough damage. They can't be too big because they'll kill too quickly. So this is a ritual that actually has specifics. Next, in this litany of horrors, acid attacks, throwing acid. Now, men are also victims of acid attacks, but most have been women. And most of these acid attacks do not kill women, but disfigure them for life. So unlike the bride burning, the dowry burning, which often kills the women but sometimes doesn't, the acid attacks usually do not, because the acid is thrown in their face. This is most common in cases where men are spurned by women, or where a woman leaves her husband or partner. And the purpose here is to disfigure the woman so she won't be acceptable for any other man. So if she's spurned someone who is a suitor, or if she seeks to leave her husband, the vengeance of throwing the acid is meant to ensure that nobody else is going to be able to get this woman. The numbers have continued to rise. Now, I mean, this is again an example of crimes that are committed that are not prosecuted, the men are not found, whatever is the cause of not succeeding in getting the people who are these perpetrators, the numbers continue to rise. Now, why would numbers continue to rise? Well, remember the case of the, I mentioned in India, of the caste that was increasing. Somehow these kinds of cases get publicity, and rather than having the kind of reaction that we would hope for, which is a crackdown, diligence on the part of the police or prosecutors or anyone else, it has seemingly the opposite effect. Other countries where acid attacks occur: Nepal, Cambodia, Vietnam, Laos, Ethiopia, and China. So when I was reading some of the articles, again in journal articles, about acid attacks, I learned to my surprise that acid attacks were common in the 19th century, maybe the early, I shouldn't say common, but they existed in the United States and in the United Kingdom, in Great Britain, in the late 19th and early 20th century. We don't hear about that anymore. There are not acid attacks in the United States and the United Kingdom. There was one recently in Russia that you probably knew about. Yes? You know about one? Right.
But in the U.S., the same dynamics occurs with different weapons and different...
Right. That's certainly the case. And I think the point that I'm trying to make, and I mean, it's certainly not universal, is whether these actions are culturally sanctioned or not. In the United States, it is not culturally sanctioned. We don't have the guns are culturally sanctioned, but not killing family members. The guns are culturally sanctioned. There's no question. We don't have to go far to learn that. But the idea that you can kill a spouse or stab a spouse for adultery is not only not culturally sanctioned, but is prosecuted in this country. And the problem that I'm trying to get is the cultural change that would be needed in some of these culturally sanctioned behaviors. Now, this doesn't mean everybody culturally sanctioned it. There are reformers, there are groups, there are NGOs, which I'm going to come to here as the hoped-for remedy, so I'm giving away the plot line, because I think there are, a cultural change could be brought about. But again, the theme is the culturally sanctioned violence. Yeah, Susan? No, I just I just read it. I mean, the point is something can be a kind of a criminal behavior or behavior of crimes against persons can be eradicated if there's a, yeah.
Are there examples where sort of behavior in a culture, in a country, has changed? And so, what can we learn?
Yeah. Well, that's the answer is I don't know. And if it is some of the same circumstances, then Dr. Yoshihama's point is accurate. I mean, at least that now they're not throwing acid, but that there are other means of violence. So if that's the acid attacks, there have been acid attacks for other considerations. I mean, the most recent one, of course, was the Kirov Ballet, the ballet director in Russia, who was attacked. I mean, this had nothing to do with culturally sanctioned violence. It had nothing to do with women, right? So there are examples, and I'm going to give another example here in a moment. So here is just to make the point about the gender disparities, again, because there are a few themes running through this. One of them is the gender disparities. Women and girls, this was the analysis of the, in 2 years, 2009, 2010, this was the latest statistics I was able to find, and men and boys, obviously. And you'll see that in the case of women, in the 2010, there were more attacks, more acid attacks on women, and in men and boys, in 2010, there were fewer. What to make of these statistics, I have no idea, but this is just a comparison of those 2 years. Here are some women in Bangladesh. Why this has been in some countries, but not others, I mean, localized. India, Bangladesh and Pakistan and Cambodia are the places that are where this has occurred most. Why this is true, I don't know, but I have more to say about this a little bit. So now, for a little break, let's go into some theories of global justice, because what we've seen, at least, and what these statistics seem to suggest, is that the countries themselves, whether they be the judicial system, the police, the criminal justice, or whatever, are not doing very much about this, especially when we see an increase. So the question then becomes, are there theories of global justice, and could this be a purview, an area where someone other than the local, state, provincial, or national governments have a role to play? Well, there are a couple of major, I won't get too theoretical, so don't get worried. There are a couple of major theories about this. One is called, and this is the global justice or international justice. One position or one view is what's called the statist conception of international justice. And this, the feature of this is that political communities that are organized into states, by which we mean nation states, are the main agents of justice. Okay, this is basically what something like the United Nations system, which is a system of nations, is meant to address and meant to deal with. And this is why there are, in the United Nations system, treaties and not only declarations, but treaties and covenants that have been signed and ratified by different governments. So that's the system, at least one system. So on this view, the statist view, principles of international justice are to regulate the relations between states in a fair way. Fairness is the justice claim, and it's the relationship between governments and states. Now, another conception, very different, is what's called the globalist, or sometimes called cosmopolitanism. The globalist conception changes the idea of the nation state as the unit of analysis. Basically, it says, hasn't worked. Nation states are not intervening, they're not doing anything, they don't cross their sovereign nations, they respect the sovereignty of other states. And that's basically the world in which we live. So this reformist globalist conception argues that the idea of the nation state is a mistaken idea because it's ineffectual, and it's replaced by the notion of what they call moral cosmopolitanism. Okay, I mean, this is a talk, not a paper, so I don't have footnotes, but you can imagine there's lots of authors who write about this. Moral cosmopolitanism is the view that every human being has a global stature as an ultimate unit of moral concern. Now, that may raise for any of us, what can I do about this? What can I do about this? I mean, I'm a professor of bioethics. What on earth could I do about this? Or almost anybody in this audience. I say almost anyone because maybe social scientists like Dr. Shoshanah, who works with other groups and are people who are both advocates, activists, and social scientists might be able to do something. But surely I can't, and probably most of the medical practitioners here. So what does this mean, moral cosmopolitanism? Well, no less a figure than Amartya Sen, the Nobel laureate, is an advocate of moral cosmopolitanism. Essentially arguing that this is a theory. And the question of how to put a moral theory, a philosophical or moral political theory into action is the big question here. So non-state actors, whoever they may be, it may not only be individuals, but other non-state actors. And in the language, in the human rights language, which some of you may be familiar with, the expected and anticipated people who have the, not people, entities that have the role of being actors are nation states, because they're the ones who have signed and ratified the human rights treaties and covenants. Non-state actors are individuals, NGOs, they could be corporations, that sometimes may do a little good. They may have the opportunity to do some good. So non-state actors can be anybody other than the nation states. So here's a person who's been contributing now to a view on global justice, and I'm just quoting her to see what some of the range of positions is. She says, is national self-determination morally justified when governments fail to meet their own citizens' health needs? Now, granted, she's talking about health needs, more specifically, what the health system and the health infrastructure can do, what the Ministry of Health has an obligation to do. But I want to broaden the question and ask not only the health needs, but other social needs. So does her question, or how, if at all, does this question apply to government's failure to protect women against the violence within families or to others? And just think of the array of examples that we've been looking at here. And my pessimism against, about the view that the nation state is the way to go comes from the evidence in how they have failed, how countries have failed to act or intervene in actual, putative, and clear cases of genocide. Rwanda, Kosovo, Bosnia. We have only to think of the inaction and the condemnation of inaction when there is clear example and evidence, ample evidence of genocide that other countries are not intervening. And of course, sometimes there are people who are critics from without and within. So Ruger's notion is that of provincial globalism. And she's arguing that her view, which is provincial globalism, is a mean between nationalism, that is the view that it's the nation state, and the statist view, and the cosmopolitan or globalist view. Well, we can't get into, she has to work this out a little bit. She hasn't done it yet, but this is the view that she's propounding. And there's another very well-known philosopher, bioethicist, who have spoken on this issue. And she's Honora O'Neill, highly regarded. And her view is that some states have the power to act as agents of justice, but use power for other ends, including injustice. If anybody's thinking of Syria at the moment, maybe that's an example. Other states, she claims, are too weak to act as primary agents of justice. So either the states themselves are unjust, or they're too weak to act. And this is just philosophical jargon. Cosmopolitan human rights discourse contains unequivocal universalist aspirations. Well, what does that mean? That means that there are some universal principles, and those universal principles are what's needed for an account of global justice. We have universal human rights. Anyone who doesn't believe that there are or should be universal principles, basically ethical principles or principles of justice, anybody who says there are no such principles doesn't believe in human rights at all. So they can just wipe off the slate of human rights, because human rights is founded in this belief that there are such things as inalienable rights that individuals have that may be rights against their government or rights against anyone else. But Honora O'Neill's question is, are universal rights matched by universal obligations? And there's a disconnect, because if we say there are rights, people have rights, then there has to be an obligation on the part of someone or some entity to fulfill those rights. Otherwise, the rights are empty. So this is what's known in philosophical thinking as the correlative rights and duties. If one wants to claim that there are certain rights, then some entity, whatever it may be, has an obligation to fulfill those rights by some obligations or duties. So what Honora O'Neill says is important to think about other possible agents of justice in weak states. And that's where I'm going here. Non-state actors as agents of justice. Who are they? Who might there be? Well, now let's talk a little bit about human rights, because that's going to be the avenue where we're talking about anything universal or global that crosses nation-state boundaries. A rights-based approach to public health typically invokes Article 12 of the International Covenant on Economic, Social, and Cultural Rights. Now we're talking about public health and what is the obligation of governments to act in the interest, in the public health of the people in their own states, their own governments. And this is probably familiar, this language is familiar to many of us. The right of everyone to the enjoyment of the highest attainable standard of physical and mental health. Well, one can, of course, debate what is the highest attainable and what is the evidence you need to determine what is the highest attainable. Well, we're not going to go there now. We're just going to look at the right. And I mean, it seems pretty, as a public health statement of rights, it seems pretty well acceptable. Also relevant is Article 3, if we're talking about gender justice, because Article 3 says the equal right of men and women to the enjoyment of all economic, social, and cultural rights. So you put these two together, and you have, at least in the sphere of public health obligations, where the obligation falls on the nation state to fulfill these rights, equal rights of men and women to the enjoyment of the highest attainable standard of physical and mental health. So this article is addressed to women's health inequalities that are caused by poor or non-existent health services, poor reproductive health services, poor services or a lack of services for women who are battered. Right? This is a health-related right. And it mentions health here. So it's health-related that is tied to the lack of infrastructure, lack of health personnel, anything that the health system can deliver. But now we have a very different, let's just look at what the covenant is. This is Article 12 of the International Covenant on Economic, Social, and Cultural Rights. Anybody know what the United States has done about this International Covenant of Human Rights? Pardon? The United States signed it, but did not ratify it. Okay? Signing is easy. The executive branch of the government signs. Who ratifies? Yeah. So this is a long time in coming. This is 1966. Okay. Not ratified by the United States. But now we come to the one that has been ratified by the United States, the International Covenant on Civil and Political Rights. And my claim here is that a rights-based, and particularly a human rights-based approach to the causes of women's harm and death stemming from these various factors that I've been talking about this morning, perhaps for too long, should invoke this covenant, the International Covenant on Civil and Political Rights. Why? Well, here is Article 6. Every human being has the inherent right to life. This right shall be protected by law. No one shall be arbitrarily deprived of his life. But perhaps more relevant, because this one gets into a little problem with the abortion and who is a person, every human being and all that, but let's set that aside. This one, everyone has a right to liberty and security of the person. Okay, liberty and security of the person. Well, this is precisely what the problem has been with all of these cases, the security of the person. And then again, the equal rights claim, which goes to the gender equality, the equal right of men and women to the enjoyment of all civil and political rights. So there's another covenant, the Convention on the Elimination of All Forms of Discrimination Against Women, 1979. What did the United States do about this one? Signed but not ratified. Why on earth would the Congress of the United States, we know why it wouldn't ratify the other one, because they don't believe in a right to health, right? So the right to the highest enjoyment of health, that's why the cultural, economic, social, and cultural rights is not ratified. Why won't the United States ratify this one? Well, it's a long story. So this convention explicitly acknowledges that extensive discrimination against women continues to exist and emphasizes such discrimination violates the principles of equality of rights and respect for human dignity. So here we have quite clearly in this international covenant, signed and ratified, by the way, by many of the countries whose governments are violating the rights of women right and left. So we do have to be somewhat skeptical about what it means to sign and ratify these conventions when we see rogue states, and I mean rogue states that punish women, that do at least as bad as Michigan correctional system does, and other things to women in those countries. So the question then becomes, these are human rights treaties and conventions. They are binding on states, right, even though states violate them right and left, but are they binding only on states parties to the convention, which then brings us back to non-state actors. So there are such things here. I'm just skimming the surface here of this human rights area. Every one of these human rights provisions has a committee. I mean, every one of these treaties has a committee, and this is the Committee on the Elimination of Discrimination Against Women. These are called treaty bodies that are supposed to monitor the countries and to see how are they doing with regard to the provisions. So paragraph 9 of General Recommendation 19 makes clear that the state has an obligation to prevent and punish private discrimination, not just discrimination that the state itself may have, but other forms. So what this says is, under general international law and specific human rights covenants, states may also be responsible for private acts if they fail to act with due diligence to prevent violations of rights, to investigate and punish acts of violence, and for providing compensation. So all this means basically is that it's not just when governments violate the rights of people, women as well as men as well as women, but that there may be, there's an obligation for non-state actors. So now my closing slides here. What can domestic governments do in this horror scene here? Governments can do a better job of fulfilling their human rights obligations under these covenants. India should enforce its dowry law, which it doesn't do. Government should strike down laws that permit or condone honor killings and enforce existing laws that prohibit honor killings. In some countries, believe it or not, there are laws that actually condone these honor killings, but in most cases, the laws prohibit them, but nobody does anything about it. And government should follow the lead of some nations that have actually brought these provisions into their constitutions and domestic legal codes. This is a response to the recent rape here. I won't, it's a lengthy report. My time is basically up, so I'm just going to zip through this. What can local and national religious leaders do? Now, there's an area for concern. Religious leaders should speak out against stoning, honor killings, and female genital mutilation, and clarify, at least within Islam, exactly what is and is not based in Sharia laws. They can very well call for adherence to secular laws that exist and support fulfilling human rights of women among practitioners of their faith. And they can join with women's faith-based groups in their struggle against stoning, honor killings, and other forms of violence. Well, my time is actually up. Foreign governments, not likely to do much. So I can skip this one here. And my conclusion, which I did have a few more slides, but I think I can stop, is that possibly the best hope will lie in local and international non-governmental organizations. They can support and work with local NGOs, such as a group called Kurdish Women Action Against Honor Killing, a group that came up among Kurds not a nation, but they exist in several different nations in the Middle East. They can provide technical and financial support for establishing shelters, educating and training police, social workers, and other agencies. And here's a poster. This is a poster, of course, obvious by critics of honor killings. And this is a group, Kurdish Women Action Against Honor Killing. So publicity may begin to galvanize some public attention to these. And there have been some striking successes. And just the one that I'm going to mention here is on the acid attacks. This is a UK-based NGO called Acid Survivors Trust International. So it's an international NGO with chapters in different countries, and they've established chapters in Bangladesh, Cambodia, Pakistan, and Uganda. This is what the founder said. And just to look very briefly at these charts, the only point here is to look at the rise in acid attacks in the top two graphs, a rise and a very uneven one in Cambodia. The bottom one that shows the decline is in Bangladesh, where they actually have an active chapter and they passed a law. And they're enforcing the law against the possession and the purchase and the storage of acid, and actually something is working. Though I mentioned something before, I just want to point out here. You see this peak in Cambodia, this peak in 2000, 2001? Why were there so many acid attacks in that particular year? This is an example of the copycat crime. There was a very well-known singer or entertainment figure who was attacked by acid in Cambodia in 2000, in that year, 2000, and in that year it spiked. So there were, I mean, that was the explanation, at least, that one reads about. So the point of showing these graphs is that something can work, and it seems to be in the NGO community acting in concert with the government. So here are some actions that the government, the third one, the Bangladeshi government passed the Acid Control Act in 2002, making a variety of actions regarding acid punishable by imprisonment, and we just saw the slope of that graph that showed that actually there was some success, and this international NGO contributed to the passage. So men respond, and obviously this is in India after the rape. Involvement of men is clearly essential, and my conclusions here is that public health interventions alone can do nothing about this. All governments who have ratified, and I would say even those who have signed and not ratified the International Covenant, have an obligation to respect, fulfill, and protect and fulfill the human rights of all these women in these countries. And this is the end of my talk. Thank you. So what can we do? Questions, comments? Who's responsible? Please. Yeah.
You mentioned companies which are doing business in India, like Packard. Is there any way that we can, some of our corporate voices, as board directors, go to them and say, you need to be aware of this issue in India. If you don't take a stand on honor killing, you need to not invest in your company anymore. I mean, I think that when we talk about unfair labor justices, is there something of the same magnitude?
Yeah, that's a very interesting question. I mean, I actually hadn't thought of that. I did mention before corporations as non-state actors that might be a force for good. I mean, there are a variety of examples. I mean, I don't have them on my fingertips in which corporations have acted in some positive way. But interestingly enough, of course, these are very powerful international corporations. I mean, Hewlett-Packard is a US corporation. So, I mean, and right. Right, the countries have factories, and all the telephone companies and the computer companies, you know every time you need technical support, you know who's answering, right? And you know who's answering the phone, you can tell by their accents, right? So those are actually very big corporations. What specifically they can do? Well, I mean, in a sense, the corporations are there with the permission of the government, so it would have to be some kind of collaborative action. But it's an interesting thought, very interesting. And we'd probably have to look at precedents of some sort to see what the success stories are, because one can only move ahead by looking at past actions that might have some success. Apartheid.
I mean, for South Africa, I mean, there was a lot of pressure on corporations by stockholders, by, you know, ordinary citizens and banks. I mean,
Right, but look at the difference here. It's a good example. But the one difference is that apartheid was the official position of the government. And the official position, if you asked India, is we have a law against dowry, you know. So it's easier in a way if you have a governmental position, which was apartheid, to say now we're going to boycott, we're not going to fly over South Africa, we're not going to buy those delicious wines that nobody even knew they had delicious wines until now. So I think partly the difference is whether or not the government itself is the agent of some of these injustices. Yes, please.
The media, what is the role that the media can play in helping to inform and to stimulate strong public opinion against, which can lead to many things, avoiding tourist trips to various countries, companies that invest there, we're not going to invest in those companies here, and so forth.
Well, the media publicized, I mean, actually in India, maybe the most recent case is something worth talking about, because the media all over the world, but also in India, that's what gave to this rise to this great response. And these crowds, those were men, the picture of men in response to the rape. So the media can bring something to public attention, which then creates outrage on the part of the people. And I mentioned this, I have to read it. I only read a couple of provisions, but they appointed this former Supreme Court Justice, Justice Verma, in India. I mean, this is an example of something really happening. And this former Supreme Court Justice was appointed to head a commission, which, unlike most things in India, languished for years. In 29 days, they came out with a report. I forget how many pages, hundreds of pages of recommendations, including citations of these very human rights provisions that I mentioned, and making proposals for reform of the laws and for actual, not only reform of the laws, but actual enforcement of the laws. So I think this is an example of media attention. I mean, and the pictures and the photos of people holding signs that say 93,000 rapes in Delhi. So it certainly got the world's attention. Now, whether anybody outside of India is doing anything about that, I mean, we're back to the question about the corporations, but certainly within India, the appointment of someone and an actually speedy report, I mean, I don't know of any reports that come out hundreds of pages in 29 days. So this was viewed as a great success and a great victory, and all I can say about that is we shall see. Yes, please. There are two in the back.
I am not a sociologist, but it strikes me that you give the example of outrage against rape in India, and you give the example of an American-trained Indian physician who still honors culture and goes back for an arranged marriage. And there's some discontinuity there. It mustn't until India truly believes that there is no social need for a caste system and there is no social need for some other system. I'm not sure where the outrage is going to go. And That's a concern that I see highlighted.
Yeah, well, I mean, I don't know how to answer that, right? Because it's certainly the most traditional cultures. And by the way, I mean, we look at India as an example, both India and Pakistan. Remember, Indira Gandhi was a prime minister. Pakistan had a woman prime minister. The prime minister of Pakistan was Harvard educated. It was Radcliffe at the time, but Harvard educated. So you have this disconnect between the treatment of women, the subjugation of women, the power of the husband and the mother-in-law, and the bride burning, and at the same time you have a country that has had, well, we haven't had yet, which is a national leader who was a woman. So the contradictions and the incongruities are there. Of course, what some people from a lot of these countries will say is you're trying to impose your Western ideas on us. And that goes to the old argument about cultural and ethical relativism. But arguably, they're not just Western ideas, because we have countries all over the world who do honor the human rights provisions, and they are viewed as universal. At least they pay lip service to them. And when you sign on to human rights, you are signing on to a covenant or a treaty to the recognition that everybody in the world deserves these rights, even if the governments themselves violate them. Okay, the gentleman just in front, yeah, please.
So what I found very interesting about this talk, about this problem in general, is thinking about these as particularly public health issues, but just as problems that are deeply rooted in local cultural traditions. And so I thought the distinction between these problems and the problems of apartheid were really interesting, because these seems like exactly the kinds of problems that outside actors will be very ineffectual in trying to deal with. There may not, in fact, be a lot. I don't think Hewlett Packard can do anything about these problems yet, because they are an outside actor. And in fact, the things that the outside actors seem to be good able to do are doing things like getting governments to sign these covenants that they then ignore, or pass these laws which they then ignore.
Right.
But the exception to that seems to be these stories of, so both of the sort of success stories that you cite, these activism in India and in northern Iraq, are based on what sound to me, and my understanding of it, are very locally rooted feminist movements. And those seem to be in your talk, the actors that are actually able to affect some sort of change, or bring attention at least. So what kind of support can you provide to those to help those things?
Well, the acid group, which actually was successful in getting the government to pass a law, that actually yes, well, I mean, to pass a law and enforce it, and then you saw the drop, you know, in the incidents. The organization actually was founded or based in the UK. But it doesn't matter where it came from, but it's an NGO and not a company. And companies will always say, industry will always say, our obligation is to our shareholders, and anything that might jeopardize, you know, their bottom line is going to be a problem for companies. Whereas an NGO, a non-governmental organization, wherever it may be, and a consortium of them, because they established chapters of this Acid Survivors Foundation in different countries, presumably some support, and I guess largely financial support. I mean, when I said before, mentioned my pessimism about about governments doing anything, if they're not going to intervene in cases of genocide, what is the likelihood? I mean, governments, the United States cares about its geopolitical interest. Does the United States really care how people treat women in India? No. They care about their geopolitical interest. And as soon as you have an area where the geopolitical interests of the United States or economic interests are involved, then there are troops, and then there's action, and then there's all kinds of stuff. So that's why I'm pessimistic about state intervention. But non-governmental organizations, if they can make networks and have more people educated and more people climbing on board, partly with financial contributions and partly with various advocacy and activism. I mean, advocacy and activism has worked in various places. One can only look for examples at the civil rights movement in this country and the women's movement to show that citizens' actions can be effective. But then you got to mobilize the citizenry. Okay, one more question. All right, Susan, we can talk later. I have to get one more from the audience. Yeah.
I was a little concerned when you're in the last slides where you seem to be distinguishing public health approaches from other approaches. Isn't what's necessary a public health approach to achieving cultural and social change? All of the tools that public health uses, like changing culture, smoking, you name it, seem to me very appropriate to this problem. Ecological approach, the way that public health looks epidemiologically, socially epidemiologically, at all of the factors that influence what's happening and looks where to intervene and measure.
You're right, and I either misspoke or didn't think it through. Okay, you're absolutely right. It is a public health problem because it's a problem of violence, and it's not only health but safety. What I suppose I intended to say is that it's not the health system, the health care system that under which this falls, but it's surely a public health system such as the World Health Organization, which is the world's public health organization, and the CDC, which deals not only with health and disease, but it's the prevention, and so that prevention of health and safety makes it a public health issue. So what I really intended to say is don't look to the health care system because that is not the right place to look at this, with the exception, just for example, correct me if I'm wrong, any OBGYNs who are in the audience, but I understand that as part of what physicians are supposed to do in their intake interviews with patients is ask questions about domestic violence, right? And that's something that is within the health, it's not the health care system, but it's with how physicians are educated. They don't do this in other countries. They don't intervene, and they don't want to know about it because they have the view this is private. This is the private sphere. So education may be part of it, but you're right, it is a public health problem, just not one that the health care system can address. That was the last question. Okay.